if you start to break, like I said, that vicious cycle and you fix insulin resistance, if that's what's part of your PCOS, or you lower your androgens, then you will be able to cycle naturally and also potentially ovulate as well, which will improve your fertility as well.
This is Doctor Talks. Dr. Roelands, great to have you back on the Beyond Infertility Summit. I am very excited to talk about PCOS today. PCOS is one of the leading causes of infertility. 1 in 2 women with PCOS struggle with infertility. So it's a really big number of women that are struggling. And it's so important to have women have the awareness, because I think, at least what I've seen a lot, is women don't always know that they have PCOS, right? They were maybe given birth control at a young age and they never got a diagnosis, or were never educated on what this is and how it's going to potentially impact their fertility in the future. So I'm really excited to dive in and just get your wisdom on all things PCOS and how we can support, if we do have PCOS, in order to help start our families. So welcome.
Thank you. I'm honored to be here. PCOS is my favorite subject to talk about, so I can't wait to dive in.
Yeah, awesome. So how does PCOS contribute to infertility? What is it about PCOS that has anything to do with fertility?
So it's generally the lack of ovulation. When you're not ovulating, then you can't get pregnant. You need the egg to get pregnant. PCOS is a very common cause for lack of ovulation, or anovulation is the medical term.
Mm.
And so women with PCOS consistently are not ovulating, and so therefore their chances of getting pregnant every month are lower and lower, depending on kind of how consistent that really is.
So anovulation is the biggest driver. So let's talk a little bit about anovulation. What in the PCOS picture contributes to that?
So both pieces of the PCOS picture actually contribute. So the insulin resistance picture that happens related to PCOS, and also the high androgens. So the high androgens certainly contribute to the lack of ovulation. And so there's some schools of thought that say, is it the high androgens that then cause the blood sugar dysregulation, which causes the lack of ovulation, or is it the blood sugar issue that causes the androgen issue, which then causes ovulation? Either way, both of those two pieces are contributing to the problem of lack
Mhm.
of ovulation. And when you have lack of ovulation, that's where getting pregnant is more difficult for women with PCOS.
Yeah. It's definitely like a chicken and egg scenario, and they both kind of feed each other. So if insulin resistance is present, then it feeds the androgen excess and vice versa. So they're accumulating and making each other worse.
Yeah, that's actually that vicious cycle related to PCOS. We have insulin resistance causing high androgens, causing inflammation, causing other parts in the body, which then causes more androgens, which causes more insulin resistance. It's just a vicious cycle that keeps repeating itself.
Yeah. Yeah. So women with PCOS, are they this ovulatory picture and the hormones that are contributing to it? Are we doomed if we've been diagnosed with PCOS and really want to have a child?
There are so many options. First of all, there are women who want to do it more natural. And so when they want to conceive more natural, I really focus on, do you have insulin resistance? Do you have high androgens? Do you have gut issues? What are those pieces of the puzzle that are making up your PCOS diagnosis? Because if you start to break, like I said, that vicious cycle and you fix insulin resistance, if that's what's part of your PCOS, or you lower your androgens, then you will be able to cycle naturally and also potentially ovulate as well, which will improve your fertility as well. So there are different, some women want to try things a little bit more natural. Some women are open to like ovulation medications, things like Clomid or Femara, or even injectable medications.
Mhm.
Some women want to ultimately do things like IVF. So there are a lot of options for sure. It's not a diagnosis that says you'll never have children by any means. I can tell you from a personal standpoint, I have PCOS and I have 4 children. So
Mhm.
it's not a no for sure.
Yeah. Yeah, I often say, at least in what I've seen, like 99 to 100% of our people with PCOS get pregnant. And so I'm of the belief there's a hidden gift, PCOS. And I like to frame it in that way because everything just seems so doom and gloom, especially when you've been struggling with something for so long and people say, "Oh, you just need to be on birth control." And that's like the last thing a woman who wants to get pregnant is going to agree to. So it's really like fun to see them transform that and be able to start ovulating and eventually do get pregnant. But the fact that they have lots of extra follicles in their ovaries is the hidden gift that they have the potential to access.
Yeah, I love that. I focus too on sort of PCOS as being a PCOS warrior, right? There are some serious benefits to having PCOS. Like women with PCOS have good quality eggs. They tend to have a lot of them, as opposed to
Mhm.
someone who might have like hypothalamic amenorrhea or might just have low
Yeah,
birth. They
yeah,
have great eggs, good quality eggs. It's just they got to get them to be kicked out of the ovary. And
yeah.
if you think about it, PCOS warriors with the testosterone are actually really good at athletics. If you look at Olympians, there was a cool
Mhm.
study done a couple years ago that said there's a high percentage of Olympian athletes who have PCOS because
Hmm.
that stronger testosterone that is present
Mhm.
is actually very good for muscle building, very good for strong endurance. So I
Right.
used to spin that concept of PCOS as you're a hardcore warrior. Like you're
Yeah.
awesome. Like there's so many benefits in some ways that you can do that other women cannot. It's about hacking your own biology and understanding how can you then make it work for you. If it's fertility is the question, or if it's just
Mhm.
being healthy is the question, like how do you maximize your own biology?
Yeah, absolutely. What can women do to help support conception with PCOS?
So making sure that they get those labs done by their doctors that really looks at the metabolic side of PCOS. What happens often when people go to a standard OB is they say, okay, or here's your estrogen, progesterone, testosterone. Here you have PCOS. You want to try to get pregnant, try for 6 months, come back when you're at this point. But truly, to give them a real true chance at trying, you have to understand, do they have any metabolic dysfunction that comes with it? So that you
Mm.
need to be tested for inflammation. You need to be tested for insulin resistance, gut health issues. You need to be tested for this metabolic picture because it doesn't matter if someone's trying for 6 months if they have pre-diabetes for the health of their pregnancy also they need to
Mhm.
to really optimize this. So
Right.
if you really wanted to go, okay, how do I make my body ready for this? Making sure you understand what is driving your PCOS symptoms, what is driving that diagnosis for you, because it could be very different than the woman next to you who has PCOS. And
Right.
throughout your lifetime, it changes. So making sure you're always really on top of getting that metabolic workup.
Mm.
And then I'm a big component of using supplements too that really help optimize nutrition because we're learning more and more is being really it's already been known but like really getting out there about how important nutrition is for fertility and not only just to make sex hormones but ultimately for egg quality and to improve your overall health. So I'm a big component of looking at what are you eating, are you able to eat to get the maximum number of nutrients that you need, or should you consider supplementation because you just can't get it in your diet. And then I think the other thing that's really important that happens a lot is women get really, okay, I'm not going to put myself where I'm going to get exposure to any toxins and I'm not going to go anywhere and I'm going to work out crazy hard. And like they sometimes get a little bit overly invested in this sort of journey. And it
Mhm.
can sometimes contribute to their cortisol being off because you have these sort of feelings like my friend got pregnant because she does cardio 4 days a week, I should do cardio. And so that doesn't necessarily work for you.
Right.
So it might stress you out if you hate cardio, right?
Or it's just like too much. Yeah.
I think it's a very personal journey. So you have to put that
Mhm.
part of it too. The way that you go through it is going to be different than your friend. So I notice that a lot of times when women are considering having a baby, they often will put themselves on these very regimented lifestyle. And it's you have to be able to also be comfortable in that journey. If you're doing something like you hate Zumba and you sign up for Zumba classes, it's going to be a disaster for you hormonally.
Yeah, like, do more of what you like. Please don't force yourself within reason, and even, like, food sometimes becomes so regimented, and in some people's cases, it needs to be, but in other cases, it's like, you can't over-regiment, you can't over-supplement and over-exercise your way to conception. I think that toning it down and really finding that balance in everything that you're doing
Hmm.
supports that journey in a more easeful way.
Yeah, and it's important to find somebody, a provider who meets the needs of what you're looking for, because there are patients who they're okay with doing natural up until, say, Clomid, but they won't do IVF, or they have sort of their own personal ethical boundaries, so what they're comfortable with. So starting off that journey with the right provider that's going to be in line with what you want to do is important, because you don't want to show up and say, I don't feel IVF is the right thing for me. And the provider is like, IVF.
And the providers, that's what we do here.
Yeah. So you have to find also that balance to where it meets your own personal values.
You mentioned, I want to go back to a couple of things that you said earlier. You mentioned inflammation as one of the possible underlying things that we might find in a metabolic workup. In terms of like someone who maybe doesn't know they have PCOS and you suspect it, or someone that is diagnosed with PCOS and you're like, okay, what else is going on? What kind of testing do you think is really necessary for you to get that like big picture metabolic functional perspective on that person in front of you?
Yeah, so if I think that they have PCOS, I want to test them for PCOS. I want to know, first of all, do they have irregular periods, right?
Mhm.
Because you need that for the diagnosis. And do they have levels of androgens that are elevated? So you're going to do DHEA, you're going to test total testosterone and free testosterone. You're going to be looking for those androgens that are elevated, because you need that to make a diagnosis. Now, if someone came into me and they had irregular periods and they have evidence of hirsutism, they have hair on their belly, or they got chin hair, they've already met the criteria. So it could
Mhm.
be physical signs, or it could be blood work that define the high androgens. And then I will definitely test them for those metabolic labs like we were referring to. But say it comes back as negative for PCOS and they still have high inflammation, then we're going to start looking into, what do they eat? What do they put on their body? What are the chemicals they may be exposed to? What if they may have had Lyme or mold 10 years ago? What is going on in the environment? Really focusing on the environment for that patient to figure out, what is this inflammation from? And inflammation can also be cortisol dysfunction. So it could be also that they're the patient that's maybe trying to lose weight and exercising 7 days a week and eating 2 carrots. Like, some of that contributes to inflammation as well. So understanding, if they're not a PCOS patient, they may just have metabolic dysfunction, and therefore having to look at those parameters as well.
And then in terms of the metabolic panel, what do you like to test on there? Let's get into the nitty gritty.
Yeah. So CRP, which is a
Yeah.
measure of inflammation, right? I do fasting leptin levels,
Okay.
fasting
Yeah.
insulin levels. So looking at those two, ghrelin, leptin, insulin kind of parameters that have to do with blood sugar balance. I like the cardio IQ, which is a more advanced lipid profile, really understanding what is someone's cardiovascular disease, because we know that PCOS has a higher chance of cardiovascular disease as we age.
Mhm.
And we don't want to just forget the 20-year-old. Like, just because you're 20 doesn't mean you don't need to have that checked
Yeah, and like preventing. Yeah.
on every PCOS patient,
Yeah.
really. And then sometimes I dive into like testosterone, because that can contribute to metabolic dysfunction of someone. And every once in a while I'll do like growth hormone. It just depends on the age of the patient as well.
Okay. Nice. And then in terms of supporting someone to have a healthy pregnancy with PCOS, what do you think is the most important? I know that we've touched a little bit on all of it, like diet, supplements, herbs, exercise, like lifestyle pieces. But if we were to get granular with it, what are the key things that people should pay attention to, specifically with PCOS, that isn't maybe necessary in women with other fertility challenges?
So understanding that it's a metabolic concern, then you'd be, while you're pregnant, you're at increased risk for hypertension in pregnancy, for diabetes in pregnancy. So understanding that you'll be watching those more carefully. So if you know that you already had blood sugar problems
Yeah.
earlier, like we had pre-diabetes, then I would, as an OB provider, be checking someone for gestational diabetes earlier in pregnancy than 20. So I'd be monitoring them, maybe even do it in the first trimester, but certainly by 20 weeks and by definitely 28 weeks, to look for that insulin resistance to turn into gestational diabetes. I would be more conscious about their blood pressure, understanding, could they develop preeclampsia. I would definitely be more conscious about mood issues too, because PCOS, you do have some issues related to mood, and pregnancy can be hard for people. It can be a hard time too. So not everybody is like walking around going, this is the best thing that ever happened to me. Some people have hard pregnancies.
Yeah.
And so if they already have depression or anxiety, really being on top of does that patient need to be treated for their depression and anxiety, knowing that we need to support their gut also during pregnancy because that's important for the mood as well.
Mhm.
And then trying to understand, is there any other components of their PCOS that we would need to be conscious of during pregnancy? For example, there is a higher chance of thyroid disease in PCOS women. And untreated hypothyroidism is really bad for a fetus. So we need to be on top of that as well as understanding we need to look for thyroid disease.
Mhm.
And so understanding those things that comorbidities or the things that can occur while someone is PCOS and the complications related to pregnancy is important for a good provider to say, okay, we don't need to not just do our standard see in 4 weeks, see at 20 weeks. No, we need to be looking at that and checking things that are a little bit more appropriate. Also check vitamin D levels because vitamin D is deficiency very common in PCOS. And it's amazing when you start checking people in pregnancy how low their vitamin D is. That baby is taking quite a bit. And I always check vitamin D levels in PCOS patients while they're pregnant just to make sure that they're getting enough for themselves and they're growing bones in the baby.
In fertility and pregnancy, vitamin D's got a lot of research coming out about how it supports
Critical.
egg quality, implantation, sperm health. There's just so many ways in which it's impacting fertility. So definitely, if you're already pregnant, really important. And if you're not pregnant yet, don't get your vitamin D checked.
And check it every year once you're not pregnant, right? Once you're done having a baby, it's important to be on top of those. Like I said, part of those I should have mentioned in the metabolic labs as well, but really important to have these series of labs once a year at your annual.
Yeah. Yeah. And I think it blows my mind how many times people come from doctors and they're like, "Oh, I go for my checkup every year." And I'm like, "How come we don't have any data? Like, how come you have a CBC and CMP and that's it?" And sorry, I know I went into doctor lingo. CMP is comprehensive metabolic panel, and CBC is just like the red blood cells, white blood cells, all of that. It's really common that people aren't being checked, and with the like you've been saying, the metabolic issues, the blood sugar, insulin, leptin, like the things that are very impactable when someone has PCOS, it's really
Yeah.
important to check regularly. And then the cardiovascular health, of course, is very important.
Yeah, and the reason they do that is the standard says that below 40, you don't need to do this sort of metabolic workup, right? But that's also because Western medicine sees PCOS as a GYN problem. But it should be considered a GYN and a metabolic problem, an endocrine problem,
Mhm.
really. So until it categorizes that, they're going to keep missing the fact that these women really need prevention, not waiting until they have a 50% chance of diabetes at 40.
Yeah.
Like half of them end up diabetic. Like
Yeah.
it makes no sense to me.
Yeah.
This is why I love integrative medicine because it's really about prevention of disease, reversal of disease, not let's wait till our hemoglobin A1C hits.
Like we're on the edge for a lot longer than we are before getting diagnosed.
That's why I love like using things like technology. I use CGMs, continuous glucose monitors a lot with PCOS patients to help them understand blood sugar balance. I use sleep aids. It could be like an Aura Ring or Apple Watch or Whoop or whatever it is,
Yeah.
a device to help understand these metabolic parameters. Because if you really learn what works for you, I know the secret to me. I
Dead
know
body, yeah.
I can have sweet potatoes, but sweet potatoes with olive oil and greens. So I can understand what works for me.
Yeah. Can you talk a little bit about the CGMs? Because I think that's very interesting in like how people can help understand their metabolic pattern, their blood sugar, stuff like that. So how do you guide people in like figuring out what their body feels good and not good with?
Yeah, so continuous glucose monitors, you just put it on the back of your arm. They look like little white patches. There is a needle attached for them. And so you wear them for 14 days. The one monitor lasts about 14 days.
Mhm.
So when I talk to patients about starting them, I usually say just eat what you normally eat in the first 7 days. And it's going to start tracking it. It can be tracked on your desktop, it can be tracked on your phone, on the app, and you can start seeing what is my waking up blood glucose level?
Mhm.
What is my glucose level after I eat breakfast? What is my glucose level when I go work out? What is my glucose level when I'm in the middle of a meeting with my boss? What is my glucose levels? And you're looking for not only how high is it rising from the baseline, but also how long is it remaining elevated? So everybody's is going to go up when you eat, but is it going up sky high or is it saying persistently up for 2, 3, 4 hours? Those are those concerns where you start going, what's the thing I did that's correlating with this?
Mhm.
So for the first 7 days, I just tell people, just track it.
Yeah.
We'll take a look at the data. Let's see where we can start making some changes because sometimes it's about, for example, I gave you the sweet potato example. That's my example when I wore a CGM.
Mhm.
What PCOS is I ate a sweet potato and it shot up to 220,
Yeah.
my blood glucose. And it was there for 3 hours. It just slowly went down. And the next time I had a sweet potato, I decided to have olive oil in it and greens. And I didn't have that giant spike. I had a nice gradual up and it came on back down within 2 hours. So I combined it with some fat, I combined it with some greens. And for me, that slowed the absorption of the glucose. So it was a little bit better option for me who loves sweet potatoes.
Mhm.
Weirdly enough, it was better than Oreos. I had two Trader Joe's Oreos multiple times apart so I could see if it was just a fluke and it didn't go up as high as it did for me for sweet potatoes.
Wow. Yeah.
Me, right? Oreos are better. Uh,
Oreos are better
but
than sweet potatoes. Oh boy.
yeah, so I use that information then to understand, okay, maybe someone's waking up blood sugar is elevated. Maybe it's their breakfast choices. Maybe it's that they're eating too late at night. Maybe so it gives some data for if you're a data person that helps you make changes because you understand what's happening to your body. It's really useful for those patients to go, oh, hey, maybe next time I have oatmeal, I should have oatmeal with chia seeds and berries because it seems to go a little better for me for blood glucose
Mhm.
levels than just oatmeal or making these sort of changes that might happen. So I like it for people who want to slow the time frame down on how do I figure out what I can eat.
Mhm.
Doing it on your own, where you would be journaling. If you decided to do it on your own, you would be like writing down what you eat, what symptoms you had, where how you felt, were you having shaky episodes, like what's going on with those symptoms, and slowly figuring out how to eat more for insulin resistance, for example, which can take some time. So I like CGMs because they really give you real-time data. And I'm not a big fan of using them forever, right? I don't think everybody should be wearing them
Mhm.
nonstop because I get a little bit neurotic about it.
That was gonna be my next question.
But I think it can really help patients who are, man, I feel like I'm doing everything right. What is the problem here? Where's the gap?
Mhm.
So I find them very useful for my patients in my practice who, especially those women who may be also perimenopausal
Mhm.
and blood and insulin resistance and blood sugar dysregulation are very common as you age, as that estrogen goes down.
Yeah.
So I find it really helpful if you have a PCOS and perimenopause lady, like it's a great tool for them.
Now for the favorite part that everyone loves to talk about, supplements. Let's talk about supplements for PCOS if we're trying to get pregnant. What are your favorite ones? Who are they helpful for? I always like to emphasize the who because I think a lot of people will hear these lists and just go out and get everything. And we as providers know that's not the way to do it. Yeah, like we can dive into the supplement piece and just talk about what are the ones that you found most success with, and then who or like what kinds of things were happening that they were most helpful for.
Yeah. So I think part of what I recommend for supplementation is certainly related to do they have insulin
Yeah.
resistance? Do they have inflammation? Do they have gut issues? What are the other components? Because across the board, I would say I almost always suggest inositol because inositol, there's not really a lot of downsides to it. We know that the data supports that there's good egg quality or improved egg quality as well as ovulation related to inositol.
Yeah.
So I don't have a problem saying to every PCOS woman who wants to conceive, go for it.
Mhm.
Inositol, at least 2 grams,
Mhm.
right? You need to at least get 2 grams. So there's very little side effects, maybe some gas, pain, some digestive discomfort, but really very few side effects to that. So inositol is always a favorite of mine. I also always suggest women, no matter what's driving their PCOS, an omega-3. If you're not someone who eats a lot of omega-3 fats, making sure, because that will also help with inflammation, which almost everybody has inflammation in their body
Mm.
in the world we live in. So omega-3s, like fish oil or flaxseed, whichever you prefer from an ethical standpoint is fine, but I certainly think omega-3s are very valuable. If you have any nutrition issues, like you don't eat a very well-rounded diet, that you should be taking your prenatal anyway. So prenatal can often help with overall balancing sort of any nutritional gaps you may have because it'll give you some vitamin A, vitamin B, folic acid, like it'll give you some of those other vitamins that are useful as well. So I think a multivitamin is also very helpful. And then B complex is almost always a very important option too, because most people need Bs for both sex hormones and neurotransmitters. So B complex is always a very valuable one as well, unless you're just somebody who just eats a ton of bell peppers and really kills it in the B vitamin department. It'd be really helpful too. And then the rest of the sort of supplements I think are really tailored towards that specific
Yeah.
person.
Yeah.
We can certainly talk about NAC. We can certainly talk vitamin D. Let's say, as we said, if you're vitamin D deficient, you better just be on a vitamin D. That's
Yeah.
right. That's just a for sure thing.
Yeah.
But the other sort of specific supplements are really geared towards where you are. Do you have a metabolic issue? What are some other components that may be related to your PCOS? So those ones I usually suggest more personal based upon the patient specific.
So, in terms of the more specifics, NAC, who I know that there's a lot of research on NAC and PCOS. There's research on NAC as just a high quality antioxidant for egg quality. Anything else? Like, how do you tailor this to people deciding do they need it or not need it?
Yeah, so if they have other metabolic issues, say they have high blood pressure or maybe pre-diabetic or other metabolic dysfunction, we know that their mitochondria take a hit, right? They have some serious mitochondrial health issues. So I am very low threshold for adding NAC for that.
Mhm.
Maybe if you're a little older trying to have a baby, that's also very helpful too for just oxidative stress and helping our bodies keep up with energy requirements. So I'm also a big fan of NAC. Yeah, I mean, it's more for what do they have other metabolic issues? And certainly if your CRP is high, this is a very useful supplement as well,
Mm.
NAC. Some would argue, I guess some people just put it on, they do it anyway for all fertility patients. And is there really a downside to it? Probably not. NAC is pretty well
Yeah.
tolerated. It's amino acids, right? They're amino acids are in proteins that we eat.
Yeah.
So is it one that you're going to likely get into harm? Probably not.
Yeah. I feel like supplements are tricky. Like, you can take a lot and it's supportive, and then you can take a lot and it's working against you. I read a paper recently that was basically like the number of supplements that people take has been shown to cause oxidative stress and deplete egg quality, right? So there's that threshold of, yes, this is the right thing for us and it'll be amazing for you. And then, no, let's like drop that off just for the sake of not adding stuff that your body has to deal with. Yeah, I still find like, where's the balance? Like, always trying to weigh the scale of, is this the right thing? Do we absolutely need it? Is it desirable, or is it not a necessity? And try to weigh that out regularly for people.
Yeah, I think that where I find the concern is that patients will often take, say, like 10 supplements, but they're taking a supplement that doesn't have enough of that ingredient that actually is used. So, for example, there's a lot of like hormone balance supplements over the counter, and they have chaseberry, but it's like chaseberry 50 milligrams.
Yeah.
That's nothing.
Yeah.
That's not going to do anything.
Right.
So I find so when I start going through people's supplements, I'm like, yes, chaseberry is fantastic, but it doesn't do anything at 50 milligrams. It's if you have a headache and I give you a quarter of one tablet of ibuprofen, you're going to be like, my headache didn't go away. And it's not a therapeutic dose.
Right.
So I think that more where I see in the clinical standpoint, I just see a lot of people that are like, oh, I saw this on Instagram. I'm going to take this one. I'm going to see this one for fertility. I'm going to take this one. I'm going to take this one. And they don't realize that they're not even getting enough of the active ingredient to do anything. And so you may not need 10, you might actually need 4 really good ones.
Absolutely. Yes,
Yeah.
exactly. So really tailoring it in. Are there any other supplements that you're a fan of, or herbs? You mentioned Vitex, which tends to be potentially a good herb for people with PCOS. What's your take?
I often use Vitex for people who are trying to get regular cycles, right?
Mm.
They really don't want to do an ovulation medication. They really want to continue to have regular cycles. And it may be that ultimately their progesterone is the issue. So we're using Vitex or chaseberry for that.
Mhm.
Supplements for like fertility, you can go down, there's a lot of different options. We could talk about vitamin E. We can talk about, there's a lot of even herbal options. You can
Yep.
even talk about Shashanda, like from an Ayurvedic medicine perspective. Like there's a lot of different sort of ones, but I think it becomes where it's really personal to that person.
Right.
And it's important to make sure that you, like I said, supplements really supplement nutrition. It doesn't make sense to take, if you're eating something and getting it appropriate levels. That would be one thing to mention is you could actually get nutrient testing, which is often covered by insurance with companies like Genova. And I don't work for them for any means, just throwing that out there for people. But you could also get nutrient testing, which I sometimes do with fertility patients to understand maybe they're actually thinking they're getting enough amino acids, but they're really not, or they're not getting vitamin B, or they're not getting certain nutrients that they think they're getting. And so therefore this is the perfect example of supplementation.
Yeah, absolutely.
Ultimately, you have to make sure your OB is on board. Whoever you're going to see for your pregnancy is on board, because there's sometimes some OBs who are a little less open-minded to you being on NAC, and probably need to make sure that you also run it by your provider to say, hey, this is what I want to try, see if it improves my ovulation and egg quality and overall health. Are you okay with me continuing this regimen?
Yeah, and you wanna find that right team that is understanding of what it is that you're doing and how it's supporting you or not, and being able to have those conversations. Because 'cause I've seen a lot of people struggle with, "Oh, my OB's not on board," or, "My RE said stop all my supplements." And, yeah, it's sometimes that's necessary, and sometimes that's not the best thing for them. So, always finding that team that is going to support you with your vision and your goal is really helpful.
Yes.
Yeah. Well, thank you so much for being with us today, Dr. Roland. It's always lovely to chat with you and hear all of your wisdom and what you're doing in your practice. So thank you for being with us today.
Thank you so much for having me. It's been a pleasure.
Thank you for tuning in to Doctor Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Doctor Talks. Real talks from real doctors on the issues that matter to you most.